she told me finally that my daughter had shot herself. And I didn't believe it. When something like that happens, you don't believe it. So I went upstairs, and I discovered that my daughter did, in fact, take her own life. And that was on the day where I thought maybe we were going to have some hope, and get her some treatment, the treatment that she actually needed. And she died because the insurance company, this is one of the reasons, the insurance company thought that she didn't need to be there anymore because she told them that she was not suicidal. What she really was doing was getting out so she could kill herself.
So you are trained as a pediatric nurse practitioner. Tell me about the day you decided, I'm going to go back to school to be a psychiatric nurse practitioner.
I actually remember that pretty clearly. We were in a doctor's office trying to get help for my daughter for her depression. And
a regular doctor or a psychiatrist?
It was a primary care doctor. Okay. And we were herded like cattle and not listened to. And the provider didn't care and hardly even looked at anybody. My daughter was barely looked at. And I was very frustrated with that process. And at the time, the therapist she was seeing was just also maybe not a good fit. So it wasn't helping my daughter. And I didn't understand about fit at that point. And I decided I was going to go between being a pediatric nurse practitioner and seeing adolescents who needed psychiatric help in my office, and then being a mother of a patient in that position. I decided I needed to go and get into the field because I needed to advocate for not only my daughter, but also other children in her position, because there was just a huge lack of mental health access and mental health expertise. After that, I did find a very kind psychiatrist that she really loved. And we were able to work with him for a long time, and that really was helpful. Okay. But in the journey with her, we encountered a lot of mental health professionals that were not professional. So that's been
hard. So as you were in school for psychiatric nurse practitioner, you are navigating the field from a patient perspective how old was your daughter at that time?
She was 15.
Okay.
And I had applied to school. I had applied. I hadn't got accepted yet, but we were trying to navigate the mental health system because she ended up being very suicidal. And we had to take her in for a behavioral health evaluation, and they decided it was appropriate to admit her. So she was admitted, but it was such a confusing process for me. And I am an educated person and in the healthcare field, and I can't imagine a lay person out there, let alone a parent who's in shock and worried about their child, being faced with the frankly negligence and incompetence that I was faced with, and that my poor daughter was faced with, even more importantly. So it just fueled my fire at that point when we were lost in all of that process, that I really needed to go into the mental health care field because people need to be, the public needs to know how the process works. They need to know how to access care. And then, my daughter was repeatedly, unfortunately, hospitalized. And it seemed at that point, no one knew what to do. Medications, there was really only one that was a good fit for her. Genetic testing for how the body processes medicine was very new, and the psychiatrist did not recommend it. And I do believe, he came from a prior generation of psychiatry, and I think that a lot of the practice was based on prior knowledge rather than up-to-date knowledge. So I think there was a gap there, and it was pretty frustrating. Nobody knew what to do. Nobody knew how to help her. Nobody suggested DBT until way later. And DBT is that therapy that gives you kind of practical coping mechanisms that I think would have really helped. And because we were not only faced with people who did not know how to help her and didn't make any difference. In fact, the hospitalizations kind of seemed to make her depression worse to a point. We were also faced with people who seemingly did not care. They had no time to talk to us. We had to hurry up and, what are your symptoms? I mean, she actually at one point was seeing a psychiatric nurse practitioner who yelled at her. My daughter was trying to explain the context in which she was feeling a certain way. And the nurse practitioner literally raised her voice and talked very disrespectfully to my daughter. And because I was in the room, I saw this and was saying, I'm not a therapist. I am a med manager. You just need to tell me your symptoms and then tell me what's wrong and I will prescribe the meds. And I was so shocked that happened. I just didn't get up and walk out until way later. It was the end of the appointment and we never went back. But I do believe, I want to believe the best in people. And I think that she was driven to that. That nurse practitioner was driven to that very unprofessional, inexcusable behavior by having a time constraint in which she could see us.
Right.
So.
And that's definitely a problem in mental health for sure.
Oh, I experienced that firsthand when I became a nurse practitioner in psychiatry myself.
Right.
We are expected as providers to see patients back to back to back. And we're considered lucky to have 30-minute appointments for follow-ups. And we're supposed to talk to a 14-year-old young lady who is suicidal in 30 minutes, probably even less than that. And not only that, you have to talk with the family as well, the parents, and how are you supposed to do all of that in 30 minutes? And how do you tell someone, okay, you're done, bye, get out? That's just not appropriate. But I feel that because we are having to see patients back to back in order to make any money, because insurance companies only reimburse so much.
Right.
The healthcare field is forced to do that. And it's not doing anyone any favors.
Yeah. So here comes the hard part. Tell the audience what happened to your daughter.
So after her 5th hospitalization, I became frustrated and decided I was going to find a residential facility that actually worked. Because residential in the hospital that we had residential in is really residential in quotes. She was there for a little over a month. I was hoping for a really good treatment program, and she was housed with very severely mentally ill people rather than people with mood disorder like she had. And it was more detrimental to her than helpful. But at the time, I thought I was doing the right thing.
Yeah, absolutely.
So it was September 5th, 2019, and I woke up with my daughter and my mom, who I'd flown in to help me with my daughter, to go visit a place in Estes Park that is a true residential facility. And it's a 6-month program, and it was going to be really good therapy. And it was other teenagers who had mood disorder the way she did. And we were going.
How much does something like that cost?
$120,000. And that was in 2019. And it was not covered by insurance at all.
And that's back to the problem.
Yeah, absolutely. And, the week before, she was in the hospital, in a local hospital again, for being suicidal. And they called me one day and they were like, she's done. She can come out now. And I had just seen her the day before I visited her. And I said, no, she's still suicidal. It's very clear. She had very extreme signs of depression. She was crying. She wasn't eating. She was losing weight. She was in the corner. And this is what they told me about why she was being discharged. And they said, well, insurance is not going to pay for that anymore. We asked her directly, is she suicidal? And she said no. And when she says no, we check a box that says no on a piece of paper. We have to fax that to the insurance company every day. And because she said no and we faxed it, the insurance company said, well, we're not going to pay for her to be there anymore. Get her out. Wouldn't there be a better way to assess for suicidality? So she gets out. I am terrified because I need to keep her safe until I can get her into a residential facility, which would have been several weeks. I flew my mom out to help. That morning, we were going to go to that facility. That was the plan. And I got up hopeful. I wasn't sure how we were going to pay for that, but I was going to help my daughter get well no matter what. Mm-hmm. I took my son to school that morning, and my mom was down in the basement just preparing for the day, getting makeup on and getting ready. And that was when my daughter found a way to get into my locked gun safe. She was much smarter than I gave her credit for. And she closed the door to my bedroom and she took her own life. And I got home, and my mom was crying and on the phone, and I couldn't figure out why. I thought maybe something had happened to my dad. But she told me finally that my daughter had shot herself. And I didn't believe it. When something like that happens, you don't believe it. Mm-hmm. So I went upstairs, and I discovered that my daughter did, in fact, take her own life. And that was on the day where I thought maybe we were going to have some hope, and get her some treatment, the treatment that she actually needed. Mm-hmm. And she died because the insurance company, this is one of the reasons, the insurance company thought that she didn't need to be there anymore because she told them that she was not suicidal. What she really was doing was getting out so she could kill herself. And I am so mad about that. There were many factors, as you know, that lead to suicide. But I'm here to tell you that one of the biggest factors is that she got out. Mm-hmm. And she got out because insurance won't pay to have her taken care of. And I find that with my patients as well. Mm-hmm. The time after she took her life, the minutes, the hours, I don't even remember. Apparently, as a mother, you don't ever expect to see your child like that. So I was not at my best.
Do you still have flashbacks?
Yes, I do. Mm-hmm. And honestly, I'm surprised that I'm not a wreck right now. But I've been a wreck.
Cameras are on. We're trying to,
trying to hold it together. I think it's also though, because I have grieved so much these last 4 years, mm-hmm. That now I'm just mad. Mm-hmm. It was just, yes, I have flashbacks. I absolutely do. Like even talking about it now, I can see things and I feel like I can smell the air in the house that day, and because my mom had something on in the crock pot, and I can't to this day cook that meal.
Mm-hmm. Understandably.
Yeah. I remember the first time it hit me. Even after seeing her that way, and I was beside myself, I feel like I came out of my body. I was screaming. I couldn't stop screaming. I almost vomited. It was just a mess. The police pulled me off of her, apparently. I barely remember that. To this day, I have very strange lapses. I just can't remember. And the firefighter, there was a young firefighter with tears streaming down his face. And he said, "I'm sorry for your loss." And this was when I was sitting in the chair in the living room. And I was like, "What? What do you mean?" you're sorry for my loss. And then, and I realized, oh, yeah, yeah. But I do believe that happened because the mental health care system failed her. And there's no coming back from that. Do I have guilt about having guns in my house? And let me just speak to that really quick to all the people who think that guns are what kills people. It's people who kill people. It's people who are also stupid or ignorant, however I want to call myself. I should have known that my daughter was smarter than I gave her credit for and would have a way to get in to the safe. And I had the keys hidden. I used to change my hiding places. I made sure she didn't have access to it. And I had her meds locked up in there as well because she was suicidal. My firearms were for my home protection. I was a single mother at that point. You know how the world is. I was raised in a family of hunters, and gun safety was always a thing. We always had locked cabinets. My children themselves went through a gun safety course when they were younger.
So what would you tell a mother right now that's kind of going through, their child is depressed, anxious, they're trying to navigate the mental health system? What would you tell that mother?
Many things. The first one is listen to your instincts. Find yourself a professional who specializes in psychiatry. Forget about primary care. They don't want to deal with it. They're really great at physical health issues. So go to somebody who has specialized in psychiatry. I highly recommend psychiatric nurse practitioners because nurses view psychiatry and psychiatric issues from a different angle.
Yeah, I always say nurses, we went to school because we're caretakers. So when we get that advanced degree, we're not only medication providers, but we're still caretakers.
Absolutely. Yeah. And we care about things like how's your sleep and how's your nutrition and who are your friends and how's your family and we're not there to be friends with them,
right?
But we do care about who they are as a whole, and we realize and recognize how things like their friends and their family and their nutrition and sleep is all affecting them as a whole. I do believe psychiatrists are wonderful, and I think there is absolutely a time and a place for them as well. I think, we are all, as mental health providers, like shoes. You got to try us on. And so I would advise this mother, number one, listen to your instincts. Number two, do not stop. Number three, you try on the pairs of shoes. And you decide what's the right fit for you. You interview nurse practitioners, you interview psychiatrists, you interview therapists, and you decide if they're a good fit. And if they're a good fit, then you work with them. And to me, a good fit is somebody who's going to listen to you and hear you. And that is possible to do, even in a short time frame. Sometimes it takes multiple visits, but you can do it. I would also tell that mother, get involved with support, because it is going to take the community to support the mother who is supporting the child. And I would say, do not think that you can just come in and get a pill and be cured. That doesn't happen. Mental health, it has been stigmatized for so long. There's not enough research, and so we are at the point, it's not the same as when you have strep throat. Your child has strep throat, you go in, they do a throat culture, right? Oh, it's strep throat. Here's the medicine for that. We do not have that in psychiatry. We have a bunch of different meds that have different studies that, this works this percentage of the time. And we have a bunch of different human beings that process these medications differently. So know ahead of time, this is a process. Several medications take 4 weeks to work minimum. You're going to have to be patient. You need good support for you and your family. And you need to do the things that you have control over, nutrition and rest and things like that.
What about the parent who is really struggling with some of this might be a behavior? And I'm not saying that was the case with your daughter, but as
Oh, no,
I
yeah.
see patients, but especially teenagers, sometimes there is kind of personality disorders that are pulling the reins in different directions, and a parent is confused about that. Like, how much of this is, mental illness? How much of this is, rebellion and trying to hurt me, and kind of those dynamics.
Right. It's difficult to navigate.
It is.
And I would say one of the things that's important to know, like between a behavior and a mood disorder issue, is how long has this lasted? Because kids are going to have behaviors, right? And that's short-lived. It's short-lived. It's a couple days or a day or, maybe even up to a week of having bad behavior, whatever that looks like. Yeah. But when, it's lasting for 2 weeks or more, or when we're not sleeping because we can't, that may be more related to mood. So in terms of behavior, that is addressed with therapy. That is not addressed with medication. And I wish that everyone knew that. Because
I always tell my parents, if I had a pill that would fix teenagers, we would be rich, right?
Yes.
But it's very complicated. Treating adolescents that are suicidal is complicated. And so we talked about suicidality being kind of multifactual. And we talked about the system and the insurance company that are being controlled by the insurance companies is definitely a big problem. But let's talk about kind of the components and the complexity of suicidality.
It's very complex. I spent the entire year after my daughter passed trying to educate myself about suicide. And it usually it's because it's a result of steps along the way in a timeline where a person gets to the point where they feel that they have no other choice. People who take their own lives, they're not cowards. They're not selfish. They are in a hole where they do not see a way out, and they think that they're doing a favor to everyone around them.
That's a good point. I want to, just hone in on that. And I don't know if you're willing to share, but as a mother who have lost children, I have been in that place. Considering suicide, and it's this feeling of exhaustion. Like I can't go anymore. Right. But really what I tell myself is, yes, you're exhausted. Go to sleep.
Do the things you can do.
Stop trying to fix this pain, because the pain, we know where our pain came from, but I think some of that suicidality, they don't know where the pain is coming from. And so then that feeling of, I can't even fix it if I don't know where it's coming from. But rest, like, I talk about in another video of like suicidality. Let's talk about it as a feeling rather than an action. Like, okay, I understand you feel like that, but let's not act on it.
Right.
But it is very, very complex.
It is.
And
it's
pain.
Oh, it's extreme pain. It is pain that they cannot get relief from. And they've tried to get relief from it many times, usually before they actually do go through with taking their own lives. And it's just, it is a missed opportunity at a doctor's office. It is a canceled therapy appointment. It is a therapist who may not see the warning signs, or friends and family who don't see the warning signs because the friends and family don't know, because it's not out there and talked about in the community. It's the provider who does not have time to see them, except for like 10 minutes and I got to go to the next patient. And so they get to the point, they start isolating themselves and they lose their community, and all of those things happen. It's the mental hospital who, discharges them because the insurance company said no, because for some reason, checking a box on a piece of paper is how you assess suicidality in this particular hospital.
Yeah.
So, but you're right. It is more of a feeling. And as a mother, to be straight up honest with you, when I saw my daughter on the floor, and she was clearly no longer with us, I immediately, and people who are parents are going to understand this, said, okay, I do not need to be here anymore because I cannot take the pain of living without my little girl. And I can't take the guilt of somehow playing a part in that. And I was looking for the gun because in my crazed mind of when you find your child dead, you're not sane. And I wanted to just go ahead and take care of it. And there was a fleeting thought of like, oh, I'm sorry, Mom, you're not going to like this, but I can't, like, why go on when you have to deal with pain every day of your life? As a parent, when you lose a child, and you know this, it is a daily occurrence when you wake up and you realize you do not have your child. I mean, when they're growing up, you always know where they are, right? In the back of your mind. Even if they're like off on vacation, you know where they are. They're like running as a background program. And I just remember like, I don't know where she is, and I grew up Christian, and I've been, believed, that I knew where she was, but at the time you just don't know, and you're hopeless. You're hopeless. So I was looking for the gun, and I was going to take my own life. And, but before that, I'd never been suicidal. And when I was looking for the gun, actually, my son's name just screamed into my head. And I'll tell you what, my son has saved me, really. Being here for him and knowing that I need to help him navigate the loss of his sister has really been the difference. But even with that, there have been plenty of times where I was in her room crying on her bed, just not understanding. And, wanting to die. And it is a feeling. You want to just not experience this pain anymore. That's the feeling. And if that means dying, then at that point, when you're in such pain, you think that's how it is. But what
would you say to someone who may be watching this and actually is thinking about killing themselves right now?
Oh, several things. One is, you do not know how much you are loved. You do not know. And maybe think of the possibility that maybe you're in such a dark place right now that you can't see. And please, just one more time, reach out for help. We have 988 now. We have crisis lines. There is a reason you are here. Otherwise, you wouldn't have been here to begin with. And no matter how bad things get, there is always someone who loves you. And there is a purpose for you. You just don't see it right now. You're in the dark. And so just try one more time. Just do the next right thing. Don't take your life. Reach out for help.
Yeah.
Because you will devastate the people around you. Like 3 of my daughter's friends ended up in the mental hospital for the first time after she died because they became suicidal. And, people that are suicidal don't realize that they cause that much pain to everyone around them. And I'm not trying to guilt trip them, but it is a fact. And I can't tell you how many people told me they wish they would have, if only they would have said this, then maybe she would be here still. And let me tell you, I've been through that too. So if you love anyone and you're suicidal, think about that person, because you don't want to cause pain to them either.
Yeah. And I've tried to do this campaign several times and it just never takes off. And I have this thing like to make a decision now when you're not suicidal, that suicide's not an option, because you and I know anybody can get to that place.
Oh yeah.
Losing a child is one of those times. But we're all capable of getting to the end of our ability to cope. And that's what suicidality is that into that rope.
Mm-hmm.
And the campaign is, make suicide not an option. And what happens when I put out videos, I get lots of comments about, one, you don't understand, I have a right to take my life. Just a lot of negativity around that's not an option, to make a choice. And in the mentally strong method, which I haven't been able to share a lot with you, but we kind of separate things, grief, trauma, behaviors, and choices.
Mm-hmm.
And what I say is the feeling of suicidality is not necessarily a choice, right?
Mm-hmm.
But the action, picking up that gun and putting it to your head, is an action.
Oh, and a choice.
And that is a choice.
Very much.
And that's where we have to, if we can make that not a choice. I'm not saying, you're never going to be suicidal,
mm-hmm.
but I'm saying you can make a choice not to do it.
Yes, because you are free to choose. She was free to choose. She could have chosen to not do it, to not pick it up and not do it. She could have chosen to fight another day, and it is a choice.
You get angry at her sometimes.
Oh, yeah. Anger is kind of my go-to.
Well, we know that's a secondary emotion, but
yeah, but it is very much because of sadness. I'm very angry. How dare you? How dare you leave me? How dare you hurt your brother? How dare you hurt all your other family and friends? I'm sorry you were suffering, but now here we are all suffering. Mm-hmm. It's like when she took her own life, it's like if she was made of glass, or if her pain was made of glass, it's like it shattered and all the little shards just stabbed into each one of us. And we are now carrying around thorns.
Yeah.
That will never go away.
Mm-hmm.
And to anyone suicidal, I would say we are all carrying pain. Mm-hmm. And the question is what are you going to do with it? And one of the best things you can do with it, in my opinion, is to turn it into a purpose and make it into something good.
Yeah.
And that is what fuels my fire to do what I'm doing.
Yeah.
Right now, I am, as a clinician, mm-hmm. trying to make a difference to each and every family that I see, mm-hmm. each and every patient I see. And
we're going to get you your own podcast. We've talked about that. I think that is super important and would be very helpful to families navigating the system.
Yeah.
But tell us a little bit about politically or system-wise, you would like to see happen to improve the system?
Yes, because the system is very broken. Mm-hmm. I wish that I had an answer for how to deal with insurance, because that is what is driving all of it.
Mm-hmm. Well, I think we should have a class action suit against the insurance companies, because I get requests for recoups all the time. I get denials for when we're trying to, charge for the services,
the actual work
that we're providing. And, one little documentation thing is wrong and we've got to give the money back, or we can't. And so we're spending a lot of time and energy on documentation,
mm-hmm.
Just to get paid.
Mm-hmm.
And then they can come 2 years later and take it back.
Pull it back.
And so that's one of my thoughts. If we,
I would love that
as, clinicians, and, but I think it's in our contract that we can't do that.
It probably is. Yeah. Well, they have 40-page contracts that nobody's going to really be able to go over with a fine-tooth comb.
Well, and what's sad is a lot of really good clinicians are going into private pay.
Yes, they are.
Because of the insurance companies.
Mm-hmm.
And I'm adamant about access, mm-hmm. and most people cannot afford private pay services.
Mm-hmm.
So I'm going to continue to fight with insurance, but that is... So tell me a little bit about some of your ideas.
Okay. So in terms of insurance, mm-hmm. yes, a class action lawsuit would be fantastic. Sign me up. I am tired of business people trying to make a business out of human beings. Mm-hmm. And so besides, and I also, by the way, another complaint I have is we, work hard in school. We go to conferences. We, as providers, try to do the right thing for our patients by educating ourselves on the latest medications that are out there, the best medicines, the new medicines that would help them. Because honestly, the medicines we have are not ideal, right?
Right.
Insurance companies decide what you get to prescribe because suddenly they went to school too, apparently.
Yeah.
And I want to sometimes, throw the prescriptions at them and be like, fine, you think you know what to do? You handle these, guys who are suffering. Insurance dictates what we can prescribe. That is a very big frustration for me. So I would change that as well. Honestly, I want to ask, if possible, I would ask all the people, if this was utopia, can we all just boycott insurance and go back to can you bring me some eggs and I'll take care of you?
Well, if the economy crashes, that might be what we're doing.
Yeah, right. Exactly. Exactly. So another thing that I think is broken is the sharing of health information with professionals, amongst professionals. It's very difficult right now because we have to document a certain way and spend so much time doing that. It's getting in the way of patient care. I think optimizing patient care would be to collaborate with therapists, because therapy and medicine, science tells us, is the best way to heal the brain. And so I think we should have shared health records. I think any institution in existence right now that is using paper charting should be eradicated.
Well, and there's the movement for EHRs.
Yeah.
And the medical, and our audience doesn't know this, but the medical community is getting better at that shared information, right?
We're working on it.
Big medical companies have Epic, and they can see things, but there's an additional law that protects your mental health records. So those can never be shared in these big systems that are now working for your medical records. And so we need a separate system that allows us to communicate. I get people discharged from the hospital all the time, and I get the same paperwork that the mother got.
Yep.
Here's your meds. This is what you're on. I'm like, well, why did we choose these meds? What happened while they were there? Did they, why did we start an antipsychotic? Was there psychotic behavior, or are we treating mood? None of that is given to us when someone is in the hospital. And then, like you said, therapists. So if we could have an Epic for mental health care, that would be
fantastic. Yes, it would be ideal. I would love that.
Create that.
Anybody have an IT person? I need an IT person. I think that's a great idea. I would love that. Yes, a shared system that's for mental health care providers, because how do we collaborate? We're just reinventing the wheel and not doing the patient any favors if we are just not talking to each other, not collaborating. And if insurance wasn't so demanding with our time and only paying us so much, we would be able to collaborate better as healthcare professionals. I wish we had a forum to speak with therapists and other providers.
And that's what people don't realize. They're like, well, what, can't you talk to my therapist? Well, one therapist would have to take time out of their schedule, which they lose money for that. The same with us, right? We cannot bill insurance companies for the 20, 30 minutes that we're on the phone with your counselor. And we still do it, but that is on us as providers, and people don't realize that.
And there is such a huge need in mental health care, such a demand. So many people need help that if we do that for each and every person, there's not going to be anything left of us.
Right.
So that's a bit of a frustration. The other thing that I would like to see is families taking more responsibility for themselves, because in this world of managed care, the patients have to be self-advocates. That means educate yourself.
Yes.
I really wish that we had a giant database online with all of the resources in a certain community available to people, because, one way I really think is helpful is NAMI, is National Alliance for Mental Illness. They're very good at educating the public about mental health and some resources, and they have support groups. So I would encourage families, be proactive. Okay. Investigate into what you're being treated with. Ask questions. Go ahead. I welcome it. Make sure you are proactive in that you seek out resources in the community. Ask people at the schools. Ask at your church. Ask go online. There's so much mental health support in the community that people do not know about.
Right.
And so self-advocate.
We have to be self-advocates. Absolutely. And what we do here is we empower people to kind of, I believe cognitive behavioral therapy is kind of the basis for all your mental health journey.
Yes.
It doesn't treat everything, but it is the basis, right? The way that you think impacts your mood and your choices.
Absolutely.
And so that's what we teach here. But also getting this idea that we're all on a mental health journey and that we all should be kind of knowing these things and taking care of these things.
Yes.
Not just reacting to now I'm depressed and suicidal. Now I'm going to figure it out, right? We're all on a mental health journey. How do we kind of care for ourselves?
Absolutely. And I think it starts with teaching the public. It starts in pre-K. I believe that schools should incorporate curriculum from CBT or DBT to at an age appropriate level. And we do it as they grow on coping skills, because none of us in our society know about coping skills very well. And that's part of your responsibility as a parent, I think, too. Learn coping skills and teach them to your children.
Right. And I think one of the things I love about coping skills is that what I think people don't realize is you're doing this the same way you're trying on shoes, right? Like, what works for you? Because many times people will say, oh, go do this to, I have several friends that absolutely love running, and running is their therapy.
Yeah.
I've tried it. It doesn't work for me.
Me neither. Me neither.
So it's like, okay, so running doesn't work for you. What works for you? You should know that before you get into extreme stress.
Exactly. That's kind of like, putting on your life vest before your boat wrecks and you sink, or to put it more in a healthcare perspective, it's like going and getting your annual checkup every year. The doctor checks on everything to make sure everything is in line. And what are you doing the whole year? You are eating right. You are exercising, supposedly. You are, you're getting enough sleep. You are taking your vitamins or whatever it is that you do to promote your physical health. Well, we need to translate that into promoting mental health, and what does that look like? Coping skills, learning what works for you, pausing to think about how you're feeling. I think we all get too caught up in the world and our lives and work to think about how we're feeling. And people need to stop and pause. How am I feeling? Because a lot of people just react without understanding why. And a lot of it is, those feelings were building up and then you exploded because you were not self-aware. So self-awareness, mindfulness, coping skills, having a plan of action before it gets to crisis point. And that's where safety plans come in. And, like when I used to take care of asthmatic children, we had an asthma action plan. We should have a mental health action plan.
Yeah. And you should know it yourself.
Yeah.
We should be teaching it, like you said, in kindergarten.
Yeah.
What works for you? Right.
And know that it is individual to a person. Yeah. Because just like medications, not one medicine works for everyone. Not one plan or coping skill will work for everyone. And I would recommend not just knowing one that works for you, but exploring and try to make that a joyful and wonderful process is trying to discover what you like. Like, that's not a bad thing.
Right.
It's an investment.
Yeah. For sure.
And parents need to understand, if you're not okay, your child is not okay. So you have a responsibility to take care of yourself and model that behavior for your child. Otherwise, your kids are not going to have a good quality of life.
Yeah. So we'll wrap up here. What would be 3 things that you would want to kind of leave with the audience about, like, turning your pain into purpose, right? What can people learn from you, and what action can they take?
So I would say first, educate yourself and advocate for yourself. I mean, 100%. Don't just trust whoever you go to just fix everything, because they do not have the time that's needed. They will be helpers along your path. And I say utilize all of your resources. So educate yourself, advocate for yourself, discover what your resources are. And you will take many resources, not just going to a psychiatric provider and getting medication, not just going and getting therapy. It's beyond that. It's going to that exercise class, starting read the book club, and it's community. We have got to get back out into community. Also, I would say, do not just take whatever you're going to be given, even if you're hospitalized. You've got to question, you've got to ask, try to partner with the providers in your healthcare, because you are partners. And I think that you should demand a better level of care. And this is not on the providers. This is on the insurance companies. And I would say, question the insurance companies, because I could tell you now, most insurance companies don't cover mental health, or very minimally cover mental health. Go back and ask your insurance companies why that is, and demand better.
Absolutely.
And then the last thing I would say is, no matter how bad it gets, try to be very mindful of those around you, because you are affecting them, and something you do really can make a difference in their lives. Love on the people that are with you, that you love on them. Don't take it for granted because they could be gone tomorrow. Just really love on them and let them know they matter. And safety wise, just open your eyes and be aware, assess your own environment and make sure it's safe if you have children, and understand that they are way smarter than you
and
would
you
expect.
Hinted on that a little bit throughout, of kind of this guilt that you carry.
Yeah.
And you are a professional. You've done a lot of work. You've done a lot of grieving. What are you able to do with that guilt?
Well, I'm trying to turn it around to educate people. For example, if you have firearms in your house, you should definitely not have a keyed lock. Have a code, or fingerprint would be better, a fingerprint lock. And so education, I'm trying to turn it into education. Like, hey, you know what? I have mistakes that I made. And how about I tell you what not to do in that regard?
Forgive yourself?
No, not really. I'm still working on that. Yeah. It's every day. It's a process, but I feel like doing the things that I'm doing is helping me work towards that.
Yeah. Yeah. All right. Thank you so much.